YouTube, what's going on, family? Welcome back to another guest episode in respect of it being Movember, Men's Health Month, us being a men's podcast. We have brought on Dr. Premal Patel. He is the medical director and co-founder of Men's Health Clinic in Manitoba. And this guy's a jack of all trades. He does so much men's health stuff in that clinic, male infertility, microsurgery, sexual medicine. He does it all. And he shows such a great passion in this episode around his focus, which is the surgery side, which I found super, super interesting. We were able to talk about prostate cancer, testosterone replacement therapy, male infertility and infertility. Listen, we broke it down and we crushed this episode.
Yeah, I mean, we got into quite a lot. We definitely turned a lot of rocks over. We talked about steroids. We talked about testosterone. We talked about Viagra and Cialis and the use of it in like young ages, like, people who are really young starting to get into Viagra and Cialis and some of the long-term effects of that. We also got into, a little bit about the shifting in environments, men going from less laborious jobs and going into a little bit more, office work and how that's affected, testosterone, libido, sexual drive, things like that. As Premal put it best, the porndemic that we're going through right now and its effects on how we view sex and view our sexual partners and how that's implicated us in, erectile dysfunction. And is it the physical body? Is it the psychology? So we definitely got into quite a bit. It was a fascinating conversation and definitely excited for you guys to all hear this for sure.
It was difficult to put together because he's not a doctor. He runs a clinic. He is a busy man. He was able to be with us. I think you remember saying he was just putting his children to bed. So he's also a family man. And this guy dropped a bomb on me. I asked him, listen, prostate cancer is big. It's like 1 in 9, right? We know the stats. Can we do something about it? Like, I'm a biohacker here. I like finding the little nuances. Tell me what I can do. His answer shook me. So this episode, I promise, will entertain. It will also provide a lot of great information around men's health, specifically prostate cancer and the Men's Health Month that we're focused on right now. So make sure to like, subscribe, download if you're listening to this anywhere else, and we'll see you inside. Welcome back, everyone. It's time for another podcast by Modern Maskulinity. I'm your co-host, CK, aka Coach Kyle.
What's going on, my people? It's Anwar Ahmed, aka A Squared.
And as mentioned, we have a fantastic guest coming on today. We're excited to get into the conversation. But before we do that, you know what time it is. It's Moo
Check. What's going on? What's going on? Premal, start with you today. How you doing, man? How you feeling today?
I'm good. I'm feeling good. I appreciate you guys having me on the podcast. This is a great opportunity.
Unreal, man. Yeah, I echo what, Kyle had mentioned there. We're honored and thankful that you made the time to be on the podcast. We're definitely excited to kind of get into some of the topics that we have here today in the name of Movember. But we want to kind of push back a little bit. One thing that we get used to as men is the idea of just, I'm good, and kind of keep it moving. So I'll rephrase the question. What is, if you were to give me your mood in like a sensation, what would you say? Like, what are the sensations that you're feeling, coming into the episode, coming into the podcast, or, even from, your day today?
It's funny you said that. I mean, yeah, you're right. 100% you just say it's all good. Actually, I tore my Achilles 3 weeks ago. So I'm here just, I'm wearing a boot right now on my left leg, and I just had to take out the garbages. So, I'm actually pretty sore right now. So, to be honest, yeah, I'm sore. I'm like, I'm happy to be sitting down right now.
That's good. I like that. That's a great answer. It's funny though, how all the little things we miss just in the context of conversation. Appreciate you answering that with honesty. That's tough, man. Honestly.
Yeah, sorry to hear that, man. An Achilles injury is tough.
Yeah, it's all good. I was playing basketball, so it happened a couple weeks ago, but healing pretty good right now, so it's okay.
Fair. Were you going for a big dunk and you came down hard or what?
Well, I was trying to.
Your Achilles answered the question of your attempt, huh?
Yeah, exactly. Yeah.
So what are you doing, man? We're a land guy. We stay on the land. Why are you trying to fly? Let's.
It's like, come on, man. Come on.
I love it. Appreciate that. Thank you, brother.
CK, man. How are you doing?
Okay.
Yeah, I'm coming
How
at
am
you.
I
I'm
doing?
coming at you.
My mood, man. I guess it's gonna come out this week. I just recently arrived in Tulum, Mexico, and it has been one of the hardest transitions I have had so far in my life. We got hit with the sickness like day one, which was very unexpected. We spent the last 3 months in Costa Rica, and it was perfect. Like no problems, no sickness, no really big adjustment except for. Transportation was a little difficult, being distant from things, but here it's been completely different. Distance is farther, environment's completely different, and the sickness was tough. It took us out. She was kind of up and down exiting, and we both had fevers. So we're just kind of coming off the back of that. So I really feel in this moment like I'm slowly coming back to grasp reality. But when you're sick, there's nothing really you can just focus on other than getting better. It's just sick and then get better, and now all of a sudden like life is beginning again, like as if you had just came out of like the birth canal. That's sometimes how it feels. So I feel a little discombobulated. I feel all over the place. So I'm hoping tomorrow a fresh wake up will treat me well. So
Okay, well, hopefully we got a torn Achilles, we got a fever. What else? This is a great way to start I was going to say, it's a great way to start a health conversation. It's a bunch of guys struggling. Just, yeah, I think my mood, I currently have been I feel like living out of a suitcase the last couple of weeks. So like, I feel like I've just been forced to be adaptable and just get comfortable where I can. And there's been no sense of groundedness in the last couple of weeks for me. I feel like I've just been fleeting with thoughts and literally different time zones and home. So one, I feel excited for this conversation because I just genuinely find some of this stuff fascinating. But the second side of that is I also feel a little bit like disorganized in my diet, in my routine, in my sleep. And I'm definitely someone of order. Like I like routine, I like order, and I feel really out of place from that. But sometimes you got to do what you got to do. Like, you got to continue to work. You got to tore Achilles. You got to continue to, record. You got a flu. So that's kind of where I'm at right now. But more so in this moment, I definitely feel really excited. Loved having guests. Love the opportunity to learn. Love the opportunity, to give the audience something new. And yeah, I think I'm excited for this conversation.
There it is, folks. As always, make sure you check in with your mood. Thank you for hearing ours and witnessing ours. So let's get into the conversation. We kind of mentioned at the beginning what we're going to get into. So we want to dive first and foremost straight into you, my man. We want to know right into the depth of who you are. And we kind of talked a bit about why we brought you on here. So let's open the gate. Let's open the floodgate here, and you kind of take the floor. Tell us a bit about who you are, and maybe get into a little bit more about who you are outside of what you do, but include that as well. Give us a full breakdown.
Sounds good. Well, I'm a Virgo, I think. Actually, I'm not even sure.
Straight.
Well,
I love it. Straight to the stars, man. Yes. That is the best intro I've ever heard.
That's what we got to look to, That's what we got to look to.
Okay, got it. So you're Virgo. Okay, continue.
Yeah. So I've been around all throughout Canada, actually. So I grew up most of my life out in the Maritimes, so in St. John, New Brunswick, and then I did my undergrad in Ottawa in health sciences, and then I went to the University of Calgary for medical school, and then I came here to the University of Manitoba where I did my urology residency. So that's after med school, you kind of pick a subspecialty. So I picked urology, which is about 5 years of surgical discipline. And then I went down to Miami where I did some further training in male infertility and sexual medicine. And then, I brought the talents back to the beach, or rather Manitoba. So I came back here and I've been here since 2019. So it's been really good. And, it's been awesome. I really love it. There's been a big need, and then we opened up the Men's Health Clinic earlier this year. And then it's just been the floodgates open, so many people, as soon as they found out that there was a clinic like this, it was awesome. I think we're just growing exponentially. People are talking, and I think what you guys are doing is fantastic as well. But it kind of echoes the sentiment amongst, I think, all men, and something that we're just not saying enough, or maybe we are saying it, and we're just not all saying it together. We kind of say it maybe in our own private homes, but that we need to have these conversations. So kudos to you guys for starting this. I think this is great.
Appreciate that. Appreciate that. Okay, good start. All right, I like it. I like it. I have a question right out of the gate. What was it like living in the Maritimes? Because I was born and raised in Canada. I lived, I swear, everywhere it feels like, and I never went to the Maritimes. It never called to me. I need a little bit more about what it was like. How long did you live there?
Yeah, I was there. So was I? I was probably there. Yeah, I was kindergarten to grade 10. So it would have been, yeah, so it would have been a good
Some formative
was it like
years.
10, yeah,
Yeah.
yeah, it was like 10 years, 10, 11 years. Yeah, it was great. Honestly, it's just a different kind of lifestyle, I guess, over there. The sad part, I haven't been back there in a long time, so I definitely want to go back and just see what it's like now
Mm,
that now that I've lived in other places. But it's always so tough as a kid because you really don't have anything to compare it to.
mm.
But yeah, a lot of Canadians have not moseyed their way over to the Maritimes, so it's definitely worth checking out.
Okay. And it's funny
Some
that you use the word mosey specifically because moseying over there feels like I'm going to mosey when I get there. So I didn't really feel super called to go. It's a very interesting word. I want to point that out.
Yeah, I think WestJet and Air Canada charging you the same amount to go to the Maritimes
I
it
know.
is to go to the Bahamas is
It's
part of the
yeah,
problem.
yeah, you're not
Um,
really feeling the merit. You rather go to you rather go down
they,
south.
Yeah.
yeah, they need to really change some of the pricing there because I think a lot of people would go check it out if it was a lot more affordable. But
Probably.
um, so I guess the second part of our question here, we like to kind of get to know, our guests, who they were as a person and their interests and kind of how they came to be. But then from all of those experiences, all those different education points, all those different specialties, you found yourself in this venture that you've called, you kind of alluded it to like the men's mental health clinic or mental or health clinic, men's health clinic, right?
Hmm.
What inspired you to, I guess it would even go back one more step further, urology? Like, why did you want to specialize in that? And at what point did you realize that you wanted to focus on men's health or men's surgery and, want to contribute to what you had alluded to as like the bigger conversation of, men and their problems? What kind of led you there?
Yeah, when you go through medical school, you sort of check out different disciplines, right? So like you don't really most people don't really know what they want to do, right? So
Mm,
they don't really have an idea. I want to do surgery. I want to do cardiology. So I went through medical school. I had an open mind. I realized early on that I wanted to do something with my hands. So I spent a lot of time looking at surgery. I really liked it. And then in Calgary, I started working with the urology group, and then I just loved it. They were
mm,
so happy. They really liked what they did. When I joined them in clinic, the patients were, it was just you were dealing with a lot of conditions. When we think about infertility or erectile dysfunction or having peeing issues with your peeing, when you fix some of those problems, you're dealing with people that are just so happy. So I found the patients were very happy, and then the surgeons were very happy. So that's was probably the biggest reason that led me into urology, because I was like, this is something that I see myself being
mm,
happy with. Like, I wanted to find a career that I wasn't going to just slave away, be miserable. Like, I really wanted to enjoy my job. And then when you go through your urology, so during that 5 years of surgical residency, urologists do massive surgeries. Like, we do very big open surgeries, we do microsurgery, we do a lot of different things. So during that period, you also have to figure out then, well, what do I want to do now within urology? Or do I just want to
mm,
be a general urologist? And so for myself, I really like teaching, I like research. So I knew I wanted to work at an academic center. So like the University of Manitoba, Toronto, those kind of places. And so to work at these places, you really want to subspecialize in something. Like you want to kind of have one niche. And then as I started spending more time, specifically around like men's health conditions, like the erectile dysfunction, infertility, all those sort of things, again, I realized that I just loved working with those patients. I found it was great conversations. And surprisingly, a lot of people weren't even really talking about it. Like when you talk
mm,
about some of the treatments for erectile dysfunction, people are just blown away. They're like, that exists? And I'm like, well, this has been around for decades.
mm,
It's so shocking how much we just don't talk about it. And then when we think about infertility, I have two kids. I have two beautiful kids. I'm very blessed. And then when you think about people struggling with fertility issues and you're able to help them, it's amazing, right? So, the highs are highs, the lows, unfortunately, are very low. But I
mm.
found that I was picking an area where I was really working with, couples and people, um, and then really going down to some topics that were very sensitive, and I felt comfortable having those conversations. And so that's kind of why I picked that area, and something that was largely missing here in Manitoba.
Hmm. Great response. I appreciate that. I really feel like I really got to know your experience through all of that. The question came up for me around, you said that you feel or felt confident and comfortable in a way having those conversations with them. Was there a part of your upbringing or a part of your like maybe experience in MD that might have created that comfortability? And why I pointed out is because I've been to the doctor many times in my life. I just feel like the ability to communicate with me and have a conversation and even want to have a conversation around what's going on with my body or my sickness, it feels like it's missing. So it's interesting to hear you say, no, I actually felt really good about that. Like what do you credit that to?
I wouldn't say my upbringing because, from a traditional Indian background, I don't even know if I don't think I've ever seen my parents kiss. So I'm not really sure how I came into this world. So, I would say that, so I would say in terms of that aspect, I'm not really sure. I don't know. I think it's, I feel like I find I like talking to people and then especially when you start communicating with something like this, people just generally open up. If a guy comes in and they've never met me before, and then all of a sudden they're going to start talking about their erections, it's already such a sensitive, it's everything's already on the table, so I feel like when you get down to it and you can really work someone through what's going on, how's it impacting them, you really connect with people on a different level. And I think, both of you are learning a lot from that experience.
Let's stay there with erectile dysfunction and fertility. I think that's a good place for us to kind of start. It was one of our our topics. What are some things that we would be surprised to learn about that in terms of like what are the age ranges of people coming in with fertility issues or erectile dysfunction problems, and is it a shocking or should you be surprised if you're having that at a young age? Is this common? Like, what are some of the things that we'd be surprised to learn about that in that space?
Yeah, so when you think about the fertility aspect, definitely up to 50% of when a couple's struggling to have, get pregnant, and usually that's after 12 months of trying consistently, it's always sort of been rooted that it's the female is the most common. There's some component there, but surprisingly, up to 50% can be male components. So there could be something on the man's side that could be contributing to that. And there could be hormonal issues like low testosterone. There's things called varicoceles, which are sort of dilated veins in the scrotum. So, the testicles, they want to be outside the body because they want to be in a cooler environment. And so if you have these dilated veins, they're exposing the testicle to heat, and they can impair the sperm count, the concentration, the movement of the sperm. These things are very common. And so a lot of people don't even know these things can compromise their fertility. So, they are more common than we think they are. And I think a lot of the focus tends to be on that female aspect that with the male is often neglected in that part of the workup. So I think now, well, I wouldn't really say now, like we're getting to that point that it's becoming more common knowledge, but it's still a long ways to go.
I had a question to kind of go back to that while you were kind of speaking about that testicle and the veins in that specific area. I heard something about like using your laptop on your like if you're in your bed and you got your laptop by your junk and like all that stuff. I heard that's like, is that correlated to erectile dysfunction at all? Is that true? Is that a myth? Is that a real thing?
And also it correlates to me in my head, like when you're driving with the car seat heater on, like the seat heater, I've heard the same thing. Like it really affects this. So I was just about to ask the same question. So we're on the same page. Let's go.
Yeah, it's a great question. I would say no. Like the data doesn't really support it. And that's because when you think about like these varicoceles, like they're exposing the testicle to that level of heat 24/7, like it's like constant. Like if you're in your hot tub, an hour a couple times a week, and if you're having your laptop on your lap, like it's just not enough to cause that same level of damage. So people ask me this question all the time, and I always give the same response: is that unless you're like unless you're living in your hot tub, like there's not much that it'd be very surprising if that would cause that much fertility issues, because something like varicoceles are doing it because it's just constant.
It's funny. I never correlated the one to the other. I was like, yeah, like the heat seater, it's a problem. People say it's a problem, but then no one ever said a hot tub was a problem.
Yeah.
A hot tub would be the most problem. If we're talking about problems here, it would obviously be the hot tub or the steam room. Like it's hilarious. I appreciate that correlation because that really clicked and made me realize how almost in a way like, wait, how did I even believe that? I'll get in the hot tub all the time.
So just to clarify, the Wi-Fi and the whatever, nothing.
Not that we know of. People have
Okay.
definitely been looking. It's always the problem is it's very hard to do any really good studies on these sort of topics, right?
Hmm.
Because when we think about fertility, oftentimes people don't really go for these tests, like a sperm test, unless there's a problem. So that's why a lot of the studies that have been based on fertility and all these things, they haven't been, not that they're not super well done. It's just they're hard to do, and there's so much variability in a sperm test. I can see somebody and their sperm test could be, this may not provide much context, but like it could range by 10, 15 million plus or minus based on when they did the collection, based on a few days apart. So it's so variable that it's doing studies on these topics can be very challenging.
Yeah, I could see that. I could definitely see that. To get into a little deeper quickly for the male fertility side of things, when you go about treating that, is it something that you do more medically, or is it something that you do more lifestyle, or is it a balance of both? Where do you normally lean to? Or is there maybe a lean that you take at all?
Yeah, it's a great question. So, when we think about, just to give an example, like just someone comes in with male infertility, or fertility workup, they've been struggling. So the first thing we do is get them to do a couple semen tests. So they'll check the semen to see what the concentration is like, the movement, if there's even sperm present. Then we'll do some hormone tests, see their testosterone levels. And so based on those results, and then probing a little bit into their lifestyle, if there's smoking, a lot of alcohol, potentially drugs, or any other medical conditions, you try to manage those first with just lifestyle recommendations and modifications. And then you may try some medications depending on if their testosterone is low. Now, you don't put someone on testosterone itself because that actually shuts off your sperm production. But there are other medications you can put on that help try to stimulate your own body's testosterone production to help drive more sperm production. Does that make sense? So taking T, so if someone goes on T, like injections or something like that, that actually shuts off your own sperm production. So you don't put them on that. But when it comes to like those varicoceles, that's actually surgery. So I often fix those surgical. And so that's some of the most common treatment options.
And when I think about like going to the pharmacy and buying testosterone boosters, for example, right? Like they're everywhere, they're very available. Is that the same kind of idea? Like if I'm taking that, then I'm kind of shutting down the other system?
You can, for sure. I mean, it all depends on what's in it, right? Like if you're thinking like testosterone booster, like potentially a supplement, some of those things are always challenging because it's not as heavily regulated. We often don't even know what's in it, right? So like it's that's always the challenging part about it. But those sort of things can potentially shut off your own sperm production.
Interesting.
This is a question that I think that many people might be quite interested in. There is a wild amount of young people using Viagra and Cialis on a regular basis. What are the long-term effects of that, if any? Like if you are using this, because I mean, I feel like these drugs are created for people at like maybe like an older age or having actual real struggles. But like there's this massive wave of young people who are able and can get can more or less get it up, and they're using it as a more of an enhancement tool, I guess, essentially. Is there long-term effects with using that at a young age? How does that kind of play a role in erectile dysfunction?
Yeah, I see a lot of young guys with erectile dysfunction, whether this is, again, more than what it was before. Again, maybe just people are talking about it, but certainly a lot more people are using these medications because they're more readily available, right? It's very simple just to go online. It's a lot of companies market this direct to your house, and it's great. I mean, at the end of the day, I think it's good that people are able to get these drugs that they may never have felt comfortable going to see a doctor. But I think when the young patients come in with erectile dysfunction, my goal is to identify, is this potentially psychogenic? So like, is this not like saying like there's psychologically wrong, but is this potentially something like they're psyching themselves out? Or is it organic? So something actually physically wrong. Now, in most situations, and I would say, again, I'm just throwing out numbers, but in 9 times out of 10, it is psychogenic. Okay. It's very uncommon for a young guy to just have erectile dysfunction unless they've had it their entire lives. Okay. Because young people, unless they have significant medical problems like diabetes, high blood pressure, all these sort of things, or they potentially had some sort of a fracture, like say like a car accident where they've actually compromised the blood flow to the penis, they shouldn't really have any issues with blood flow. Okay, so in those young people, my goal is to identify. So what, when did this start? How long has it been going on for? Was this a sudden onset? What about masturbation? Can you masturbate without any problems? And sometimes that often tells me I have some guys who say I can masturbate no problem, but I just can't have sex. Well, trying to get them to sort of believe that it's more psychological, because oftentimes they come in thinking, listen, it's a blood flow issue. There's something going on down there, and it's really, and it can be sort of. It can take a few times to sort of have that conversation and figure out what the root of the problem is. Now, when it comes to the pills, they've been around for a long time. Whether they have any long-term problems, we don't really know. Overall, all the studies have been safe. But my biggest concern about the pills is the dependence on it, is that they're going to feel like they always need this to perform. When in fact, let's just talk about this. Like, maybe we need to go to some sex therapy. Maybe we just need to talk about it. Let's break this cycle so we don't get you to take these pills that you, one, don't need and that aren't cheap, So I think it's trying to break those cycles. And more often than that, that's not successful. The problem is a lot of these sort of therapists, unfortunately, a lot of insurance coverages don't cover them. So sometimes that could be a big barrier to even getting appointments, because it can be pretty costly. What's easier than just taking a pill that they'll be like, I'll just take the pill, it'll be fine, than trying to get to the root cause of this. So it's, it's not a simple fix, but I think trying to figure out the root cause is definitely what I try to do. Whether successful or not is not always the case though.
I think the psychology thing is kind of interesting. Especially if there's there's the masturbation ability, but there's not the ability to have sex. Like, do you think that there is, and I mean, I'm not trying to put, ideas in your head, but do you think that the increase in technology and porn has something to do with some of the analysis of, like erectile dysfunction? Like, sure, in the comforts of my own bed, watching certain things, it's fine. And then when it comes to like real human interaction with real people, there's a level of freeze, or a level of overthinking, and it doesn't happen. Is there a correlation there? Because there is a lot of literature out there these days that are talking about the porn pandemic, like the epidemic that we're going through right now, which is a pretty scary one for young men.
Yeah, the porndemic. No, 100%. When it comes to those sort of things, I think it can have an impact because, as most guys know, they can stimulate themselves to what they want. You know what I'm saying? Like they know what they're going for. And so if they cannot replicate that during intercourse, they may, one, lose the erection, or they may say, I just can't feel it sometimes during sex. And it's because they're not stimulating themselves to what they're used to. So the more frequent that you are masturbating, and the less, sexual activity you're having, or any sort of like interaction, it's gonna be hard for you to get that same level. And that's where I like it when patients bring their partners in, if they have a partner, right? To have that conversation with them there as well. It's be like, have the partner there. Let's figure this out together. Because that conversation needs to happen. Is that you guys need to change positions? You guys need to talk about it. Like, what's going on? What works for you? What works for them? And I think there's a lot of embarrassment, right? People just don't want to talk about it. It takes them just the courage to come to the appointment, and then having to bring it up to the partner, they feel that they're letting them down. Well, I found most times is that when the partner's there, they're actually pretty receptive. They want to fix this just as much as the partner does. Like, okay, let's get this going. Like, let's work together. So, it just goes back to just having this conversation and figuring out how this works.
I'm going to backtrack here, the casualness of your statement, the porndemic, and then he just moves on with the conversation like that's a normal sentence. It's not a normal sentence, and I actually appreciate that language. I was like, yes, this guy's thought about this before, I can tell.
Keep me up at night.
Yeah. Something interesting about that too is so coming off of the back of my experience with porn and slowly coming to the realization of what it was doing to me psychologically, and trying my best to slowly drift away from it. What was interesting for me to hear you say just now is the habitual nature of it. Like, I never thought about it like a morning routine. Like, and not to say I did it in the morning. That's not what I'm saying. What I'm saying is that like I have a morning routine where I do certain things, right? So then as time passes and I do them, that's just what I get used to. But then you try to change that up and you say, do something different. That's incredibly difficult for me to do. I have this system, I have this thing in place. And I've never correlated the application of when I was watching porn more frequently, that would be almost the way in which my mind habituates sexual actions, right? So when sex would come, it's not that it was hard for me at the time, but it was in ways I probably mentally enjoyed it less, specifically because I was so used to this other experience. For me, that just kind of hit home. I was like, the habitual nature of it really lands for me.
Yeah, and that's the thing. I think we're all creatures of habit, you know, like we all get into routines, and then once you start breaking up that routine, it can be quite challenging. And it just you know, we can take this example and just apply it to everything, so that it's all and that's the thing. Once I start having these conversations with patients, a lot of times it's like a light bulb goes off. Like, oh yeah, I get it. Like I may need to do this, or if they start losing their erection during intercourse, well, it's like, okay, well, maybe you got to maybe you have to cut back the masturbation. Maybe you have to, so things like that, where people don't realize these patterns because it's just so common to them, and they don't make that connections,
Mm-hmm.
What are some, this is just more of an open question. When you open something like your clinic, right, and you open the doors, I always say that, like, you had mentioned that it's hard enough for them to come in, and then for them to be vulnerable enough to bring their partner in, right? It shows this like level of like stigma breaking, and I need to do this to get to this. When you open your doors, what's just coming in very easily, and what's harder for people to admit that they have a problem with? Like, is there something that, like, is the testosterone conversation a little bit easier for men to get into? Like, hey man, I think that like my libido is down, or can I get testosterone replacement? Is there, or I saw something on your guys' page about surgeries for is it the penis itself, in terms of making it like larger or more blood flow? Like, is there something that men are lining up at the door for, and then there's areas where there's a little bit more of a coaching and an education element to it? And how would you decipher those kind of stigmas within the clinic?
Yeah, it's a good question. I feel like most, I think just as you were kind of talking about how young guys are able to get pills and stuff like that easier, or Viagra, Cialis. I feel like a lot of these conditions, men sort of come out now and kind of seek them, whether it's like hormone replacement or erections or curvature issues. I think the one thing that they often don't talk about is the impact it's having on their relationship. I think that's always tends to be, they don't really know, because I don't think they often talk about it with their partner, is that like talking about what they're struggling with, very easy for guys to talk. I think when they come in, they want to seek help, they want to figure out what's going on and fix it. But then when you often ask, how is this impacting your relationship, I think that's where the challenging part comes in, because they don't often know. They say, well, we haven't really talked about it. Well, it's been like 6 months since we even tried, or 9 months, or I don't even bother trying anymore because I know it's not going to work. And so when I ask, have you talked to your partner? They said, no, so that, you would think the first part would be the toughest part, like talking about what's going on. That part, I find that it's great that they want to find help and they're willing to, kind of tell me what's going on. But then how it's actually impacting them, that's where the struggle is.
What do you guys do as far as creating a safe space for that? Because I think that you guys are a men's health clinic, so the idea of like having some sort of therapy or psychological standpoint behind that all, I don't know if you guys do or not in your clinic, but what do you think creates that safety for men to be able to open up about those problems? Because naturally we look online and everyone's kind of closed off behind. I mean, it's online, so it's obviously different, but we're still working through that vulnerability stigma. We're still working through that movement, and yours is specifically a men's clinic. Do you feel like it's because you're specifically a men's clinic and that's it? Or is there something extra or more that you feel you guys do in order to be able to provide that safe space for them to have that kind of conversation with you?
Yeah, great question. Like, I think, I don't know if there's anything specifically that we're doing. We've definitely like, we would love to have a therapist working at our clinic. I think that'd be number one. Would be great to have that opportunity. There's some therapists within Winnipeg that we refer to, so I think that's good. But unfortunately, it's just another sort of barrier. Like, once they're in the clinic, I think it would make things, people will be more receptive to it. When you have to think about, oh, now I got to wait another referral. Where's their office? You're just sort of creating potential roadblocks to them actually going to seek it. I think that just the men's health clinic aspect of it, I think the fact that when they look at the website, or even when they come to the waiting room and they see tons of other patients there, like, it's not infrequent when people say, oh man, I had no idea, like, there were so many men having similar issues. I mean, they don't know exactly what other people are there for, but they know it's within the realm of men's health, that they're like, oh wow, this is super busy. So I think just that in itself has definitely gotten people realizing how common these conditions are.
Interesting. I like that. It's like there's like a mini community behind it when they walk in the door. That's interesting. Okay, thanks for that. Thanks. That gives a good perspective for sure.
Yeah, I think it, it's almost by having a place where it's called the Men's Health Clinic. By entering that room, I think you already kind of know, like, I can talk about my problems here, like, this is specifically for us. This is specifically, so I think that in itself feels like, hey, these people are expecting conversations about erectile dysfunction, or, even the way you guys have, like, laid out your Instagram page, it's like, you guys have almost kind of gave them the questions or the way to speak to you in a way of, you've kind of have offered up the blueprint essentially of like, hey, we deal with these problems all the time. Come in if this is you. It makes it, you bring up an amazing point there of saying that, like, the real vulnerability isn't to the doctor, it's to their partner. They actually are struggling to admit to their partner what they're going through. And this is really just another step of them trying to figure it out in silence. You're just one more person that they're going to in their way of figuring out what the problem is without telling anybody about it, which is often what we talk about is, we're really solution oriented, but we don't want to talk about how we're going about the process, and we want to suffer in that silence. So it's interesting that it's showing up in that space as well. I wanted to steer the conversation in a different direction. Another area that men are is this testosterone therapy, replacement therapy. I think testosterone is a really interesting conversation. I think every single ad or anything that kind of goes down, I think that guys are just, that's the buzzword for guys. You want to sell something medical to a guy, you need more testosterone. There's a guy who's jacked. There's all these, these pills, and testosterone is the thing. I think, one, I'm curious as to just what testosterone replacement therapy is, straight up. Second, I'm curious about how steroids play a role in testosterone. We can kind of go into that a little bit. But yeah, what is testosterone replacement therapy, and what does that look like? How would you be able to identify that for yourself if you were feeling like, this is what I need to do? Like, what are markers for that?
Yeah, when it comes to testosterone deficiency, so having low testosterone, it's very, like, there's a lot of signs and symptoms from it. So you may present with irritability, mood changes, you may be more fatigued, more tired, and then you may have some of those sexual side effects, right? You may have issues with erections, libido, loss of desire, other issues like not gaining enough muscle mass. So it is quite varied, and I think that's always a struggle with testosterone deficiency, in that there's a lot of questionnaires that existed, but none of them were very specific to testosterone deficiency. So it's not like you can take a questionnaire and say, oh, I have all the symptoms, I for sure have low testosterone. The problem is a lot of other conditions also mimic a lot of that, right? So there's so much overlap. So when we think about testosterone replacement therapy, what is it? So it's, essentially just taking testosterone, which is a hormone. So in terms of how you get it, there's a lot of different formulations. So you talked about pills, there's injections, there's gels. In the US, there's pellets, so there's creams. Like, there's a lot of different ways testosterone can be absorbed by the body. And so when I put people on testosterone replacement therapy, you try to follow a guideline. So, as a urologist, we follow our Canadian Urological Association guidelines. So I'm one of the committee members. So we wrote sort of guidelines on how you should be monitoring. Well, number one, who should get testosterone replacement therapy, how they should be properly investigated, what are the risks of it, what are the different formulations, and then the follow up with them. So typically you put them on the therapy, and then usually at about 3 months, 6 months, not like 9, 12, you repeat some blood work, see them in the office, check their symptoms that they were experiencing, see how it's been improving. So it's a pretty standard sort of protocol in terms of how we monitor the progression on TRT. I think the struggle with TRT, and not so much here in Canada, I saw that a lot in the States, was that there's a big push to try to get TRT because it's going to, like you said, it's going to make me jacked. It's going to, make me better in this aspect or that. And I don't think we should have that much in the Canada per se, because I think it's not as much marketed here than it would be in the States. In the US, especially where I trained down in Miami, there's tea clinics, right? So if you weren't going to prescribe someone tea, well, they're just going to go next door and get tea. Here it's a little bit more regulated, and I think I think it's not, I wouldn't say abused, but it's just not as mainstream as I saw down in the US. In terms of testosterone, I think it's great. Just like any other hormone. We replaced thyroid hormone, we replace other hormones. Like, I just think of it as just, if you're low in it, you need it, let's replace it. But is there ways that we could potentially get you to raise your own, right? Like just like when we talk about that erectile dysfunction conversation, young guys, let's get to the root cause of this. Is it sleep? Is it nutritional issues? Is it not exercising? All those definitely play a factor in low testosterone. Now, the one struggle is that low T going to cause you the inability to even do those things? If I'm like, hey man, you got to go to the gym 5 days a week, you'll get your T back up. And then he's like, doc, I'm so tired. Like, how could I go to the gym if I can't even how do you expect me to go to the gym if I don't have the energy to do it? And that's where T is great. Like, I tell people, we can put you on some testosterone, give you some energy back, but then you got to make those lifestyle changes, or you're just going to be on it for life, And I think people resonate with that. They're like, great. And then they start to feel better. Then they're going to the gym, they're losing weight. So I think identifying those signs and symptoms, making sure you actually do have low testosterone on blood work, trying to identify any potential reversible causes for low testosterone, and then talking about the risk factors and all those sort of things of being on T, and then going on it. I don't think that's harmful in the right patient.
Do you feel like the ease of access is, well, I think we kind of said it, it's almost creating I would go as far as saying a possible dependency on, if it can always access it very easily, especially in the States, it's something you could just go and get without worries. I think as a man, we correlate testosterone levels with how manly we are. Right? So if I have a lot of testosterone, that must mean I'm more of a man. And if I have low testosterone, I'm less of a man. Do you think there is some truth to the idea that because it's become so accessible, one, two, it's become such a big conversation around masculinity that people are just kind of getting it whenever and however, that may actually be one of the reasons why we're all having such a struggle with it, is because we just go and do it without addressing the actual root issues. Like, we're not checking in on our own lifestyles, we're not checking in on how we could be contributing to it as a person. Instead, we just see the problem and then we say, here's the fixer, let me just do that instead. In my head, it sounds to me like, in a way, we're almost like using and abusing that freedom, or that idea that we can just go and top it up and then we'll be good. Like, we don't actually have to solve the actual problem. I'm not quite sure if that question actually came through clearly, but I think what I was just trying to get at is the dependency itself, could that be causing overall lower testosterone levels amongst men in general?
Yeah, well, I think it also just stems from the fact that, I don't think, as we get older, I think generally speaking, most men are not as physically active as maybe they think they are. Or that it's, even myself, like today I just did 20 push-ups. I was like, oh, great, that's perfect. But, but back in the day, you'd be going to the gym 4 days a week, right? You'd be going to the gym 4 days a week. You'd be playing sports. Like, you'd be doing all these things that, you're just not doing it as often, I could probably compare my own physical level activity. I may think I'm physically active, but nothing compared to what I was. And so you're taking such a huge dive in your level of physical activity, and this seems quite mainstream that a lot of guys are just not as active as they used to be. And it could be for tons of reasons, right? Like, work can get busy, life can get busy. But then going into that conversation about like just quick fixes, I think marketing and has definitely caused an issue with that, right? Saying, let's fix this right now. You just need to get a blood test, get you on some medications. We'll get you back to where you were before. I think we're, as physicians and healthcare professionals, and honestly everybody, like we really have to start taking a look back at just even our own lifestyle aspects, because a lot of medical conditions could be prevented just by sleep, diet, exercise. Like we can definitely deal with a lot of problems just by very simple lifestyle modifications. You know, I'm not going to say that they're easy to do. Like I struggle with trying to maintain like a very active lifestyle too. But I think that's the biggest thing. And then the ease of access is not helping that per se. I think it's great that you can actually go somewhere and feel comfortable getting it, but I think we need to focus on the lifestyle stuff. Does that make sense?
Yep, 100%. And I think my question was more or less obvious. It was more of me like processing out loud this idea of having such access and essentially being a quick fix, and then of course that being a problem without addressing my own root. So I think I was working through it. So your language helped me provide more context and kind of close that loop. So I appreciate that.
Yeah, I think that you also kind of, you start to have another conversation, right? I think even before this conversation, me and Kyle were talking about how the average, like what we're doing in terms of environment nowadays is just not as physical. Like before, you didn't even need to work out, right? Like if we go even further back, just being alive, hunting, gathering, that was just, and like that was a workout, right? Your day-to-day life was a workout. We were very, very labor heavy. And as we now get into, COVID really showed us, it's like now we're going from our bedroom to the second room to be on a computer, to sit down all day, to, work 12 hours and then get up, and we're barely even moving. We're barely physical. And then you just lose that feeling of, I don't feel like a man. I don't feel like I got any kind of, gusto. I don't got any kind of, boost. I'm going to go see someone about it. And then, now, TRT becomes a lot more like a very good option, but ultimately you kind of still need that time, right? You still got to put in the time to make that TRT last, or, make the right adjustment. Because it sounds like in your clinic what you really want to practice is, let's do this to get you on your way, but let's get you on your way, and we are in a very quick fix, 2-day delivery, like, same day shipping, just give me something. Let me feel the feeling that I want to feel. And we've really lost vision of like delayed gratification. I feel like as a society, as we're really just trying to find people to fix problems in the short term. And it sounds like it could be a little bit more problematic, though could be really good for a short-term boost to ultimately kind of gaining your own control and your own power back.
Well, and it's a struggle too. I mean, like a lot of these hormone replacement, this is common with other conditions as well, like thyroid, is that you get a honeymoon phase. So say you've been feeling low because your testosterone is low. Then all of a sudden you go on test and you're like, I feel great. And then it's been like that for 4 to 6 weeks. Then all of a sudden you're like, it's not like you're dipping, but you're getting used to that level. And then all of a sudden it's not uncommon where people come back and say, I think my levels are low. And you'll check them and say, no, they're normal. It's because you've been so low, you're finally back to normal, but then you get a bit of a honeymoon. And so you're kind of thinking, well, I need more. Like I need to increase my dose. Like I need to get that feeling back again. And
chasing a high.
Yeah, right. And then you're putting, when it comes to testosterone, we don't really know. So one of the biggest controversies with testosterone replacement therapy is cardiovascular disease. So like potential risks of heart attacks and strokes and all these sort of things, because testosterone can actually make your blood thicker. So there's a hematocrit, which is it's a thickness of your blood. We monitor that very closely on testosterone, and so it's still debated. And there's a big study right now that's being recruited trying to answer that question: does testosterone actually increase your risk of cardiovascular disease? The opposite is true, though. So men who have low testosterone have a higher risk of cardiovascular disease because they tend to have other medical problems that put them at a risk for heart disease. Okay, so like cholesterol issues, diabetes, all these sort of things. So that is the biggest player. So men who have low T tend to have those other medical problems that put them at a risk. Okay, but test itself, whether that actually increases your risk, a bit controversial. We don't really know, but that's why I'm always cautious about trying to increase doses, is because, you're potentially asking for these theoretical risks of all these other, big consequences, and going back to the infertility thing, I think a lot of, time to time, I'll see young patients who are concerned about their testosterone levels, but are you going to put someone on testosterone who's in their 30s? When are you going to stop? Are you going to put them on for the rest of their life? What about fertility? So there's all these things that you need to take into consideration before you start going down this kind of rabbit hole, putting someone on medication that, one, are they ever going to get off of it? Why are they on it? So, these don't turn into just a 5-minute appointment. So you got to really have this conversation with patients and give them the time and figure out what's actually going on.
You said something interesting that you said from time to time I get young people in. Is that more of a rare occurrence for you at the Men's Health Clinic, or what is the general age range that comes in? Because I've had thoughts about, should I get checked? Like, I don't know, I'm 30, like, I don't really know, and I feel good. But like, is it important? Does it help to check? I think naturally it would help to check, but is it really that necessary? Like, I go through that inner conflict. So it sounded to me like younger people aren't necessarily coming in. Is that something you feel that maybe could be normalized or should be normalized at any point? And what do you think, or what have you noticed is the average age range that comes into your clinic?
Yeah, it's always challenging because it depends on what sort of disease state we're talking about. Like, like infertility, they're all going to be late 20s, 30s, some 40s. Erectile dysfunction, penile curvature is usually more in the 40s, 50s, 60s, sometimes 70, probably 70, 80s-year-old men. And then peeing problems. And as men get older, the prostate becomes bigger. So typically men who present with problems with emptying their bladder, 40s, 50s, 60s, and older. When it comes to the testosterone, it's a very big spread. It does tend to be in that older age group, the 40s, 50s, and 60s, but then, you're going to get some younger guys there as well. Certainly there's some people that come in that have questions about their testosterone level. Now, we don't really know what it means at that age, right? If someone comes in, all we know is what is normal, right? Like, and even that is a little bit debated because younger people actually have a higher level of testosterone, like your testosterone compared to someone who's 60. What is your reference range? Right now, it's basically a blanket statement that we say 10.4, which is like 300 nanograms is what the US marker is. And that's kind of questionable as well. Well, if you're 310, well, that's normal. Now, that's not really normal for someone your age, right? So there's always, there's a lot of debate about like what is normal in younger people versus older people and so forth. So it's definitely an interesting topic.
On that kind of conversation, I guess, about getting checked and ages and things like that, let's pivot into prostate cancer. And we're seeing a lot of, obviously Movember does a good job of trying to cover that and talk about that. And I remember, this coming across my space, a couple of years ago and think, I got to go get checked. And then I was told, you're a little too young, buddy. You probably shouldn't be getting checked. So what is like the appropriate time to be a bit more, obviously we're trying to create awareness around prostate, but like there's also probably an age where you need to be actually like doing something about it or being more proactive about it. What is that timeline? What does that age look like? And what can you share to the audience about like, prostate cancer and it's how maybe we can be preventative about it or what we should know about it?
Yeah. So prostate cancer, the most common cancer among men, right? So 1 in 9 Canadian men will be diagnosed with prostate cancer. Fortunately, when it comes to prostate cancer, there's a wide spread, okay, in terms of aggressiveness. The fortunate thing is that a lot of prostate cancer tends to be indolent, so not as aggressive. So there's even a lot of prostate cancers that we watch, right? We actually don't even need to treat them. It's something called active surveillance. So the nice thing is that we are learning a lot more about prostate cancer. And that there are some forms of prostate cancer that some men can safely be observed for 1, 2, 3, 4, many years without needing to undergo any intervention. In terms of actually talking about screening, so basically it's a PSA test. So it's called prostate-specific antigens, which is a blood test, and we usually recommend it about age 55. So if you have no risk factors, and that's typically people, so what are risk factors for prostate cancer? It tends to be if you've had a family history of it. Okay. And when we think about family history, the closer that person is to you and the earlier their age of diagnosis and, the severity of it. So it's different conversation if, say, someone's had, an uncle who was in their 80s who had prostate cancer, than somebody who says, well, my brother or my father was in their 40s or 50s or 60s. So the closer that relative is to you, the higher your potential risk. And that's where screening tends to be a little bit earlier. So that could be 45 or 50. And that test involves that PSA test, so a blood test, and then a rectal examination where basically we can feel the prostate, and we feel for any lumps or bumps or any hard areas. And then putting those two together, that may warrant either repeating that blood test, getting an MRI to see if there's any lumps or bumps, and then eventually getting a biopsy. So basically getting a biopsy of that prostate and seeing what type of cancer it is, or if it is cancer. And at that point, once you have all that information, then you can think about treatment options.
Interesting. So 55 is the age. So if you have no clinical history, and say you have no family issues, no nothing, and you're going on your mosey way, in your 50s is when you should start to maybe do some checks and get ahead of the problem.
Yeah, exactly. Like you get that blood test done, get that rectal examination, and then periodic blood tests, and then depending on what that PSA is, in some men, if it's very low, we often don't need to repeat it for a few years. So there's so much still left to learn about prostate cancer, but there's definitely some big pushes, and we're trying to. The one thing that happened historically, and when it comes to a lot of these blood tests, is that overdiagnosis, right? So whenever you say that C word, people want it out, right? It's cancer. Take it out, take it out, take it out. But then we started realizing that a lot of this cancer was not all the same, right? And so you were often treating men, you were removing the prostate, you were causing issues with erections, you were potentially causing them having incontinence or leakage, and they were having very low-grade prostate cancer that could be just actively surveyed. Okay. Now we're trying our best to identify the men who are going to benefit the most from intervention or treatment. So either radiation or surgery. So it's it's definitely a moving sort of thing that's happening. Canada's definitely been one of the biggest in terms of that active surveillance. There's a guy in Toronto who was sort of spearheaded active surveillance, and it's kind of a global thing that a lot of centers are picking up. Like it's still the trouble is just that C word, right? Once you say that word, it's hard to tell a patient, hey, don't worry about it. It's cancer. It's fine. So how do you say
that's going to
that?
be a no. Yeah.
Right. Like it's so it's, there's been almost even like nowadays, there's even a push that some of these types of low grade prostate cancer, even reclassifying them as non-cancer, because that word has such a powerful connotation to it.
Huge.
And so it's huge, right? So how do you tell someone, yo, we're just going to watch it. It's all good.
Yeah. We're just going to do some active surveillance on your cancer. Just let it do its thing. Yeah.
Right.
I could see that being an extremely difficult conversation. Yeah, I could see, and just the way our psychology is with words and things that we know to be, that word is just, we've heard way too much. That word could be synonymously just replaced with the word death at this point. It's a scary word. It's like live death. It feels like, unfortunately, and I know a lot of people have suffered with real challenges with that word. So I could see how trying to have a cat being like, hey, we're going to live surveillance. This is not a conversation that's going to go over very well. Quick little pivot here. Actually, I do want to finish one more thing there. Anything you can do proactively? I've heard Kegel. I've heard like being active with Kegels. I've heard all kinds of things. Like men should be doing Kegels as well. Like, is this a real thing? Is that what we should be kind of, taking a pee and then holding it and then peeing again? Is this all factual, or should we just live your life and then reassess at 55?
And I want to add something on there before you ask. It feels like I've just accepted the fact that 1 in 9 men get this. So speaking to the proactive side, like, can you speak to why it's so common? Like, why is it 1 in 9? And is there a way to decrease that number? Is that number getting like worse? Are we getting like closer to 1 in 8? Like, because it's such a big conversation every year, I've never really questioned like, wait, why? Why is this a thing that men experience so frequently? So if you could add that on to proactiveness, that would, I think, be beneficial.
Yeah, you know what? It's a great question. Unfortunately, I don't really have a great answer for you. Like, why is it so common, right? Like, why? And it's it's something that I don't really have an answer for. I don't think we quite understand why it is this
Fair.
common. Just like any other cancer, as a lot of them are associated with aging. So you're just as you get older, your risk of all cells are mutating. So you start extrapolating that times whatever many years that you're living, or how many times they divide. You're eventually there's a chance of some sort of mutation happening, right? And over time your body doesn't have that ability to correct things as it did when you're a kid, right? So there's definitely some concepts of that going on. In terms of preventative, there's really not much of anything, to be honest, in terms of a lot of that stuff. People ask all the time about, you mentioned the Kegels and all these sort of things. We do recommend that in men who've had prostate surgery, because that can help with some of the leakage. In terms of preventativeness from prostate cancer, not really, right? Like it all goes back to that lifestyle aspect, right? Like reducing, like smoking, that's a big culprit with a lot of cancers, right? Trying to limit alcohol. And then it even just goes to making sure you're eating healthy, trying to avoid any other medical conditions. I think it's such a big thing from just that aspect that there's really not much else. And people often ask about vitamins, and I get that asked so much when it comes to fertility. There's been big studies that have looked at vitamins in terms of trying to preventative for prostate cancer and even fertility. There's been shown to be no benefit, right? In fact, there was actually even some questions about harm from some of these vitamins. We get so much from our nutrition. Like we have such easy access to food and fruits and vegetables that all of us are getting more than enough vitamins that we need, that anything additional is not really going to be beneficial from preventative standpoint.
Listen, you just let every biohacking man down with that statement. You're like, listen, there's nothing you can do. There's no biohack you can take. And I'm thinking here, like, this man's lying. Like, there's got to be a biohack. There's for sure got to be like an infrared sauna light, or like a cold enough shower I could take. That's all I could think about. There's got to be.
Listen, man, I would love to make Dr. Patel's probiotics, but I couldn't sleep at night. It's just, and people ask all that time. Like it is, and that's what kind of I do get quite disappointed in terms of just a lot of these companies do market vitamins so aggressively, and it's I'm sure there's a place for it. There certainly are. I got some people who, if you think about people who get a lot of, think about like a truck driver, somebody who's potentially not at home having home cooked meals, maybe eating out frequently. Sure, great role, if you're not getting that nutritional support. But I think again, I know I keep harping with the lifestyle aspect, but I think that's a lot of times that can fix a lot of these issues.
Yep.
Sorry, man, gotta get back in the gym.
It's worse that you're calling me out on that, dude. It's been a week because of this transition, so I'm literally feeling personally called out in this moment. Great timing. Great timing.
Well, I think we've covered a lot of the topics that we wanted to kind of cover. I think that there's a lot there to kind of dissect and pick at. I think that there's a lot of what we really wanted to do is just introduce some of these topics and maybe some of the challenges that are coming with. I think there's been some super amazing takeaways. To kind of, I guess, wrap it up, we have a last question here that we like to leave people with. But before we do that, we were wondering if where can people find you at? Where can people kind of follow the journey a little bit? What do you want to plug in terms of plugging what you got going on in the pod?
Yeah, again, I want to thank you guys. Thanks for the opportunity for having me on here. I think this was fantastic. Great conversation. Yeah, check out the website. So I think the biggest thing is checking out the website, mhclinic.ca. Has our Instagram, has the videos that we posted, trying to educate, men, their partners, just trying to have that conversation. And then just reaching out to the clinic. So we see patients all across Canada. We even have some patients down in the States that sometimes reach out to us as well. So, we're just trying to be that source for men's health in Canada.
Amazing. Go check them out. If you have any questions, you're curious, if it feels like it's a friendly space and they're willing to kind of get you answers if they don't have them. So go definitely check them out. Our last kind of leading question here is if you were on your deathbed and there was a young man who kind of entered your space and it was the last man you'd kind of speak to, and he said, "Hey, I got questions about men's health." And you only had 3 things you could tell this person, and everything else you've done in terms of work and a collective is gone. You're leaving this person with 3 things that they can take away and they can walk away with from the space of men's health. What would those 3 things be? What would be kind of your last kind of, I guess, parting gift to this young man?
Very good question. I think the one thing, and I think all of us probably have felt this at some point, is that if you feel like you're alone dealing with the condition, you're definitely not. I think and I see this every day, and, I think a lot of men struggle with this, is that if you feel that you have something going on, talk about it, because for sure you're not alone. There's somebody else that's dealing with this, and that there are treatment options for it. Number 2, there's no quick fixes. I think when it comes to a lot of these sort of things we talked about, the erections, testosterone, all that sort of stuff, it takes work, it takes time. And we often don't, and not to go too long on this, but like when we think about that erectile issue, people will always say, or, most people will say it just kind of stopped at this certain point, but they may not be able to see the microcosm of what led to it. It could be 5-10 years of not being as physically active, not managing underlying conditions, and these vessels or blood flow, it just slowly and slowly over time gradually gets smaller and smaller and smaller, and eventually the only point you really realize is that where it didn't work. And so it's going to take, maybe not that long, but it's going to take a period of time to reverse that. So I think, putting that time and effort in, it's not going to be a quick fix, but it's going to be worth it in the end. So I think those are 2 biggest things. What's my third one? My third one is just, be open with your partner. I think a lot of times people don't realize how much of an effort or not impact your partner can have on these sort of things, right? Like maybe it's something that you guys can work for together, So just to go in a story, when it comes to like erections, so oftentimes we give people Viagra, Cialis. When that fails or people are getting side effects, you can try injections. So injections are medications where basically you're injecting your penis, right? And so it's a drug you take 10 to 15 minutes beforehand. It's been around for a long time, works very well. And so, I've had patients who come in and say, I don't know how I feel about this. I don't know if I can inject myself. And then, but I say, well, bring your partner and let's have this conversation. And sometimes they'll say, no, they won't want to do it. But then the partner comes and it's like, oh yeah, I'll figure that out. That's not a problem. It'd be easy to do, and then they're like, oh, I didn't know you'd be okay with that. So just talk to them about it, because I think it's, you need to have that conversation. And if you have a partner, that's your partner in crime. So like, just, be open with them. Your struggles are their struggles, and, and together you can kind of, overcome a lot of things.
Some fire parting gifts for us.
Absolutely.
Appreciate that.
You know what I love about it too is that it's somehow universally found its way to relate to our, shift in episodes for Movember, where we specifically focused on is relational health affecting your actual health in our last episode, just kind of correlating the two. And it's not that you directly said that, but you kind of directly said that when you're like, listen, like they'll help you in that moment. That's improving his overall like health through that experience. And I like the fact that you were tying that in, because obviously my experience, I'm a relational coach. So for me, that spoke to me well, but just the missing link in so much of this is that like your partner is likely going to support you in that. I love that third one. Like, I think that it was a great addition. Great addition. Thank you for expressing that.
Oh, great, man. I think that kind of brings the episode to a close. Coach Kyle, you want to close it out?
Let's walk it out. Absolutely. Thank you again so much for being here with us. I appreciate you. We appreciate you. And I hope all the listeners, you listened closely. We're coming right back around to the lifestyle. Like, this is exactly where we figured it, and it's going to be difficult, right? But that's how life works. Life is a challenge, and the most challenging things are the most rewarding. So thank you for that reminder, and thank you for giving us this information during Movember. This is an important month, and we're all doing our best to support this movement as always, but it's not just November that we do it, it's every month. that's why we have this podcast. So thank you again for being here. Thank you again for providing the information, and thank you for the work you do. I don't know when I'll get a chance to come to Manitoba and check out the clinic, but I hope I get to, because I love what you guys are doing. I know Anwar does as well, and I'm so grateful that we were able to connect with you. So we really appreciate that. And thank you if anyone's listening. Thank you for being here. We appreciate you as well for checking in on your health as a man. And we hope to see you in the next episode. By the way, this will be on YouTube, so go check it out, and we'll see you in the next episode.